Back in February, I had a stroke that put me in the hospital. I was medevaced from Fairbanks, Alaska to Anchorage. They did some MRIs, and then finally they decided to do an angiogram of the brain and found out that I had Moyamoya. The neurologist there, he said he didn't know that much about it because it is so rare. So he asked if I was okay with coming to Seattle to Swedish, and I said yes.
Moyamoya disease is a rare condition, but here at Swedish Neuroscience Institute at the Moyamoya Center, we see it quite frequently. For patients that ignore the symptoms of Moyamoya disease, the outcomes can be quite catastrophic.
When I got diagnosed, I was very scared. I was terrified. I did get on the internet and research different facilities that had dealt with Moyamoya. I knew that Swedish had handled a lot of Moyamoya cases, so picking the facility, I felt very comfortable.
Moyamoya disease is a complicated disease and every patient is different, and a lot of patients don't actually need surgery. In terms of the surgery, a high volume center is really important because these are very complex procedures that not every vascular neurosurgeon performs bypass procedures, and it's important to have that multidisciplinary team who can do the bypasses if needed, and it's important to go somewhere where they're done frequently, as well as the imaging with neuroradiology and the advanced imaging techniques which we have now.
So the first meeting I had with Dr. Monteith, my first visit, he went over everything. He explained the disease, he explained how rare it was, if I had the surgery, if I didn't have the surgery, what would happen. He seemed very knowledgeable and I felt very comfortable.
Once patients understand the condition and when we go through the imaging and the pictures of the arteries, I think it's easy for most patients to see that we sometimes need to do the bypass operation to get more blood up there as soon as possible. In Catherine's case, she clearly needed the operation because she was having these transient ischemic attacks or strokes that reversed themselves, and so she knew something needed to be done and it needed to be done soon. So Catherine had disease affecting both sides of the brain, which is typical for Moyamoya disease. Since she'd recovered so well from the first operation, within a week we did the second side.
I'm very grateful that both of my surgeries were a success. Everybody that I came in contact with, I would like to thank them for their caring, how they treated me. They were on top of everything. The nurses, the doctors, ICU. Swedish is just an amazing place.
Well, it's very rewarding for the whole team here at the Moyamoya Center here at Swedish when patients like Catherine do well, and we're optimistic that she's going to go on and lead a normal, healthy, fulfilling life. It always makes our team very proud that patients do as well as she does when we all work so hard to make sure every patient gets the best outcome possible.
I'm very excited for the future. I can't wait to be able to get out and do what I enjoy doing, and I just cannot wait for that to get back to normal.